One of the reasons that I became a physician was I really wanted to be there for my patients. I wanted to be a support to them and to help them no matter what the situation. So this field allowed me to do that, and allows me to do that, and I love it. I love being there for my patients. I love being a support to them, and then it allows me to do all the skills that I learned in medical school to be a doctor. 100%, because sometimes I think when you're a specialist, you focus on just the heart or just the lung, but I have to focus on the person as a whole, and that's why I enjoy my job. I do think that there is a special bond to develop, and the reason why is, these patients are being diagnosed with a life-threatening illness, and for a lot of these people, their worlds are crushed, they're devastated, they don't know how they're going to go on, and so you need a doctor that will be there for you and be a support, and so I think that's where that bond comes from, and it's very important. I want my patients to all know that I'm there for them, and I'll be going through that fight with them, and for me, that is the reward that I get. Now, I know sometimes the end of the journey is not what we expect. Sometimes it's difficult. I lose patients, and that's heartbreaking. But being able to go along on that journey with them is definitely rewarding to me, and it makes me feel like I'm making a difference.
I was so fortunate to have Dr. Gardner. She is caring and considerate, and she just made me feel calm. I felt at ease with her because I had already gone through everything once, and the idea of having to go through it again seemed so difficult, but she really kept me together and made me realize it was going to be okay.
Dr. Gardner to me was a gift from heaven as far as I'm concerned, because she's a very compassionate person, very knowledgeable about everything. And like I said, Florida cancer specialists hit a home run when they put her on as a staff, on their staff, because there's nothing like her. I just, when I see her, I kind of glow.
I think that's phenomenal how much growth we've had in the treatment of cancer in 20 years. And it's exciting when I can go to my patients and talk about targeted therapies and talk even here at FCS about clinical trials and new things that are coming through the pipeline, to let them know that there are different options available, and that's very exciting. It's also part of why I like my job, because it is changing and I have to keep up with things, and so I do read a lot and try to keep up with the latest and the newest, but I want to definitely let my patients know that I'm there for them, and I want to do the best that I can for them, and we can definitely offer that here, and that's definitely why I enjoy working here.